Thank you. Good afternoon and welcome to this press conference. It has been more than 3 weeks since Singapore transited to phase 3 of reopening. As we have indicated before, we expected cases to rise as we open up and allow more interactions among our people. And indeed, in the past 2 weeks, we have seen an increase in the number of locally transmitted cases. The past week alone, there were an average of 3 cases in the community a day. We have also seen recently 4 clusters involving mainly workplace and household transmissions. But beyond the numbers, what is worrying is that these cases and clusters reflect a certain degree of complacency. Amongst the community cases in the past 2 weeks, about 3/4 of them were symptomatic, yet half of them had not sought medical treatment after they had experienced symptoms, and some continue to go to work and intermingle within the community. Some may think that given the low number of cases in the community overall, it cannot be me who has COVID-19. While we have built up our contact tracing and testing capabilities to rapidly trace, test, and ring-fence cases, we need the first cases to come forward when they fall ill. Otherwise, they may go on to infect many others before we are able to discover these subsequent cases. This will put their loved ones and colleagues at risk and ultimately jeopardize our efforts to fight the COVID-19 as a community. In view of the rising community cases, the multi-ministry task force has decided that we will need to calibrate the pace and scale at which certain activities in the community can resume. My co-chair, Minister Lawrence Wong, will share more later. The task force will continue to adjust our measures as the local situation evolves. We urge everyone to play our part to stay vigilant and be socially responsible. Even as we adjust our community measures, vaccination is another key strategy in our fight against COVID-19. We are mounting the largest vaccination exercise in our history. Our vaccination efforts are making steady progress. As of this afternoon, more than 60,000 individuals have received their first dose of the vaccine. On 20th January alone, we vaccinated close to 10,000 individuals in a day. These numbers are expected to rise substantially in the coming weeks as we continue to ramp up our vaccination capacity and operations while maintaining the highest standards of safety. So far, 4 vaccination centers are up and running across Singapore, and we are preparing to open more even as we speak. Next week, we will reach an important milestone in our vaccination journey as we embark on our first phase of community vaccination for our seniors. From 27 January, we will commence vaccination of our seniors, starting with conducting pilots in Ang Mo Kio and Tanjong Pagar, where a larger number of seniors reside. Thereafter, vaccinations will be progressively extended to seniors across the island from mid-February onwards. To pilot the vaccination of seniors in Ang Mo Kio and Tanjong Pagar, we will set up 2 vaccination centers at Teck Ghee Community Club and Tanjong Pagar Community Club by 1st February. But even before that, from 25th January, seniors residing in Ang Mo Kio and Tanjong Pagar will be able to book their appointment to be vaccinated at our polyclinics. As this is a pilot, we will send letters to selected seniors in Ang Mo Kio and Tanjong Pagar to invite them for vaccination and share more details with them. Seniors who need help in booking their appointment need not worry. Community volunteers from the People's Association, as well as our Silver Generation ambassadors, will be conducting house visits and tapping on existing grassroots activities to answer queries and help our seniors book an appointment for the vaccination. Seniors in Ang Mo Kio and Tanjong Pagar can also go to respective community clubs to seek assistance. The People's Association will share more details nearer the date. We will set up more vaccination centers island-wide over the next few weeks. to ensure that all Singaporeans and long-term residents can conveniently receive their vaccinations at a center near their home when their turn comes. Alongside the vaccination centers, we are also preparing our polyclinics and selected public health preparedness clinics, or PHPCs, to serve as vaccination centers. But a key factor is the supply of vaccines. Late last week, Pfizer announced that it is upgrading its European factory, and as a result, some countries will receive fewer doses of its vaccines. One of our scheduled shipments has been delayed as a result. As I have mentioned, we must expect this as global demand for vaccine is growing rapidly. We will continue to monitor our supplies closely to meet our target of vaccinating all Singaporeans and long-term residents in Singapore by the end of this year. But we will need to calibrate our rollout in tandem with our supplies. While we have made steady progress on the vaccination front, we must remember that the journey is far from over. Vaccination is but one of a whole suite of measures that must work hand in hand to keep transmissions low. The key to keeping one another safe lies in each one of us. If we all do our part to adhere strictly to the safe management measures and be socially responsible, we can turn the tide of the rising community cases without having to impose drastic measures. So let us keep up our fight and remain vigilant, especially over the coming festive Chinese New Year period. Let me say a few words in Mandarin. 大家下午好。新加坡进入了第3阶段的解封，到目前已经超过3个星期了。就如我们之前所说，我们在重新开放的时候，我们会允许大家有更多的交流和接触，但是同时呢，病例预料也会增加。在过去的2个星期，我们确实也看到本地传染的病例有所增加，但在过去的这1周，社区的病例平均每天就有3起。另外，也出现了4个感染群，主要是在工作场所和家里的传播。但是，除了这些数字呢，更加令人担心的是，这些病例和新感染群凸显了人们在某种程度上放松了警戒。在过去2周的社区病例中，约有3/4出现了症状，但是他们当中有1半的人没有去看医生，有一些还继续出外去工作。也在社区里与其他的人交流接触，这些人或许会以为社区病例不多，不可能就是我染上这病吧。基于社区病例的逐渐的增加，跨部门工作小组也决定，我们必须调整某些社区活动可以复苏的速度和规模。黄循财部长接着下来会分享更多的详情，特别是在这个新春佳节将到的时候，我们在庆祝新年的当儿，也必须要提高警惕。我们邻近的许多的国家也陆续了加强防范措施，以防病毒再进一步的扩散。所以，我们呼吁国人和我们互相配合，让我们能够安然地度过这个新年。对抗疫情的另外一个重要的环节是接种疫苗。新加坡已经展开我国历史上最大规模的疫苗接种行动。疫苗接种行动目前取得良好的进展，到目前为止已经超过6万人注射了第1剂的疫苗，但在本月20日这1天内，接种人数就将近1万人。下个星期，我们将会抵达另一个重要的里程碑。因为我们将要展开首阶段的社区接种行动，首先是为我们的年长者接种疫苗。本月27日起，我们会在年长者居民较多的红帽桥区和大荣巴格区试行为年长者接种疫苗。之后，从2月中旬，陆续会为其他的选区的年长者提供疫苗的接种。从2月1日起，在德义民众俱乐部和大荣巴格民众俱乐部内将各设一个新的接种中心，为的是让这2区的年长者能够进行疫苗的接种。 其实，在那之前呢，从本月的25日开始，住在红帽桥区和丹戎巴格区的年长者，也可以预约到靠近他们住家的综合诊所接种疫苗。由于这是一项试行型计划，我们会寄信给这2个地区的一些年长者，邀请他们来接种疫苗，也和他们分享更多的详情。那些需要帮忙的年长者也不需要太担心。人民协会的社区义工以及我们的关怀乐龄大使会开始做家访，也会通过现有的基层活动解答大家的提问，帮助年长者预约接种。红帽桥区和丹戎巴格区的年长者也可以到靠近他们住家的联络所寻求援助，人协导师会提供更多的详情。我们接着下来几周内会在全国设立更多的接种中心，确保所有的国人和长期居民在轮到他们的时候，可以很便利的到他们住家附近的接种中心完成接种。我们在接种疫苗方面所取得的进展令人鼓舞，但是我们必须谨记，保障彼此安全的关键落在我们每一个人的身上。我们必须各尽本分，严格遵守安全的管理措施，并且负起社会责任。我们这样的话，才能够扭转社区病例持续增多的趋势。所以我希望大家能够和我们合作，继续努力对抗疫情，让我们能够保持警惕，安全过年。谢谢大家。Now I'd like to invite DMS to give us a quick update on the medical situation.
Thank you very much, Minister. As of today, the 22nd of January, the Ministry of Health has preliminarily confirmed 1 new case of locally transmitted COVID-19 infection. Based on our investigation so far, that case is in the community, and there are no new cases in the dormitories. In all, there are 14 imported cases who have already been placed on a stay-home notice or isolated upon arrival in Singapore. In total, there are 15 new cases of COVID-19 infection in Singapore today. We're still working through the rest of the details of the cases, and further updates will be shared via the MOH press release that will be issued later tonight.
Good evening. It's been nearly a month since we entered into phase 3 of our reopening. And as Minister Gan said just now, we had anticipated then that with more interactions in the community, there was a possibility of more cases emerging. Hence, we had also said that our reopening plans is not a one-way street. It's not just continued reopening, because we would have to monitor the situation and make constant adjustments and calibrations to our measures where necessary. So we've seen the latest trends, as you heard just now, and we've seen how new cases and even clusters have emerged in the community. These cases emerge after a lag, because we know that there is an incubation period. Whenever a case pops up today, it's really the result of interactions taking place a week or even 2 weeks ago. So what we are seeing today is really the result of the increase in activities happening over the New Year period, after we entered into phase 3. And this is reflected in other indicators too. For example, on a daily basis, we have individuals going to the polyclinics to seek treatment for normal cough and cold or acute respiratory infection, or having a flu or flu-like symptoms. During the circuit breaker last year, the number of cases going to the polyclinic for ARI cases dropped to an all-time low, just 500 a day. Now that has doubled to 1,000. It's still below pre-COVID norms, but the fact is that the numbers have gone up. And that is simply a reflection that with more interactions, with more human activities, there is an increased chance of transmission of any infectious disease. It can happen with a common cold or normal flu virus. It can happen also for COVID-19. And that's why we are very concerned, because compared to, say, a month ago, our vulnerability has increased, and the situation can escalate very rapidly, especially with the likelihood of more interactions and activities taking place over the Chinese New Year period. And we only need to recall what happened last year when we indeed saw a spike in cases after Chinese New Year, and we had many clusters linked to Chinese New Year gatherings. This was last year. We don't want a repeat of that happening, and that's why we are making a preemptive move now to tighten some of our measures. Currently, the rule is that households can receive up to 8 visitors at any time. At any time, you can receive up to 8 visitors in your home. This is okay for normal circumstances, because under normal circumstances, you would not have so many people visiting your home. But I think for Chinese New Year, this potentially will cause difficulties. Even residents during this period, or over the last few weeks when I'm in my constituency, they have come up to me and asked, is it really the case that I can visit any number of times during Chinese New Year? It sounds rather lax. You know, they are not quite sure that you can really visit multiple times a day. So we think that there is a need to tighten, and the new requirement will be that we limit visits to 8 distinct visitors per household per day. And this new requirement, this new rule will begin next Tuesday, 26th of January. If you're going out to do visits, what I mentioned earlier applies to people visiting your home. But if you're going out to do visits yourself, then we would strongly encourage and advise that you limit your visits to not more than 2 other households per day. Especially during the Chinese New Year period, we would strongly encourage everyone to keep in touch with your friends virtually rather than have physical meetings or physical gatherings. And if you do want to have physical visits, limit these visits to your family members only. And at the same time, limit it to not more than 2 other households per day. Besides home visits, we know that dining out remains an activity that carries some risk, because you are without your mask on and you are in a space with many people for some prolonged period of time. That's why we already have rules in place which include keeping your mask on if you are not eating or drinking, and ensuring that there's no singing or live performances at F&B establishments. Therefore, all diners must continue to abide by these rules and keep their voices down. There should not be any singing or loud shouting or talking during a meal. And we have to be especially careful during the Chinese New Year period. So if you are out in a restaurant and you want to order yishen, well, they may serve you the yishen, but during the lo hei, you have to keep your mask on, and there should be no shouting of auspicious phrases by the F&B staff or by the patrons in the restaurant. Likewise, for reunion dinners, you can go out to dine together as a family in a table of 8, but there should not be any multiple table bookings. This is a current rule. It's an ongoing rule, and we will continue to enforce it. So during this period going forward, we are getting our safe distancing ambassadors and enforcement officers to go out. We will be stepping up our enforcement checks. The officers will be going out to F&B outlets, to shopping malls, and to other crowded public venues. Strict enforcement actions will be taken against any individuals and business operators that breach the safe management measures. The penalties would include fines and prosecution in court, depending on the severity of the offense. And for business operators that breach the rules, their operations will be suspended. So for all businesses, we again remind them to take the rules very seriously, do not take chances, and make sure that there is 100% compliance. The I think broader context that we are in right now should be apparent to everyone. The virus is raging everywhere in the world, and including in places all around Asia which have up to now been successful in controlling the infection. Many of these places are now seeing new cases emerging, including in Singapore. And that's why around Asia, many regions, many places, China, in Hong Kong, in Taiwan, they too are putting in place curbs and restrictions on Chinese New Year celebrations. So let us be mentally prepared that Chinese New Year this year will not be the same as before. It will be quieter, it will be more subdued, and we will have to be more disciplined in how we go about our daily activities and interactions. The task force will continue to monitor very carefully the infection situation, and we will not hesitate to take additional measures if and when necessary. But we seek everyone's cooperation to uphold all the prevailing measures and the new ones which we have just announced so that we can get through this hump without having to impose any additional drastic measures. Thank you.
Questions from the media?
Thank you, Ministers and DMS. We will now begin with the Q&A segment. Dear members of the media, please remember to use the raise hand function on Zoom if you would like to ask a question, and a reminder to keep to one question only. If you are called upon, you will be prompted to unmute yourself. Please do so accordingly. May we now have the first question from Timothy from ST.
Hi, thank you, Ministers, GMS. Now, I'd like to ask, does the task force, especially the GMS, have any advisories for other CNY customs, such as the exchanging of oranges, ang paos, and the tossing of yusheng in one's own home, where people may not be wearing masks? Also, earlier, Mr. Wong used words such as should and as much as possible. Why are we not taking a firmer stance on this? Thank you.
What I've highlighted just now include new rules which will be enforced. So, for example, the new rule that there will be a cap of 8 distinct visitors per household per day, that will be introduced as part of new regulations. That's why it will only start on Tuesday. We need time to promulgate the new regulations, and that will be enforced. And if there are breaches, our enforcement officers will be again doing checks. If there are breaches, then the individuals who breach the new rules will be taken to task. Likewise, when I talk about restaurant settings and the rules around what you should or should not do, including keeping your mask on, not shouting, not singing, many of them are existing rules already. We are clarifying them that indeed in the New Year context, if you have Yishen, Lo Hei, then there should not be any shouting, there should not be any, loud, you should keep your mask on even when you are doing the tossing of the Yisheng. So that is really a clarification of existing rules. We will also be enforcing them. And again, if there are breaches in any restaurant by any individuals, enforcement actions will be taken. So we are not just talking about advisories. We are putting in place new rules which will be enforced. Beyond that, there are many things which will be hard to enforce. Interactions within a home. And what happens when you visit and what happens between one another. It's impossible to enforce such interactions within the family setting or the home setting. In such instances, it will be really advisory, and that's why we have been encouraging everyone to meet virtually, to even go with electronic rate packets this year. But these are things that, good practices that we will continue to encourage, and really it's up to individuals themselves to do their part and cooperate with these advisories.
Maybe I'll just add that even with these rules, we mustn't forget the advisory that we have given before how to protect the seniors at home. When you visit your seniors or any other family member, remember to wash your hand when you arrive at the home. Make sure that you keep your mask on as much as possible, but of course you need to talk to your seniors. You may not have a choice. You may share a meal with your seniors. You have to remove your mask, that's fine, but exercise caution. Always bear in mind the safety of the seniors in your mind, so that do what you can to protect them. Practice the basic personal hygiene, and if you need to give them oranges or ang pao, for example, make sure you wash your hand and you don't pass on diseases to them, not just COVID-19, any other disease as well. So I think the basic personal hygiene practices should continue despite all the changes in the rules.
Thank you, Minister. Can we have the next question from Zipeng from Zhao Bao, please?
Hi, good afternoon, ministers and DMS. This is Zhipeng from Zaobao. Regarding the cap of 8 distinct visitors per household per day, earlier Minister Lawrence mentioned that enforcement actions will be taken. But how exactly are we going to enforce this new rule? For example, will the enforcement officers be conducting door-to-door spot checks? And also for Ang Mo Kio and Tanjong Pagar, right? How many seniors are expected to be vaccinated for the pilots in these 2 areas? And after these 2 areas, what is the exact operational plan to roll out vaccination to seniors in other areas of Singapore? Thank you.
Well, for home visits, obviously it's not going to be so easy, but the enforcement officers will, do random spot checks. There are also possibilities where neighbors may call up. It has already happened before. We've received feedback from residents during the circuit breaker, for example, or even during phase 1. Remember when we were in phase 1, there were also rules in place with regard to house visits. So this is not new. We know it's not easy to enforce. It may not be 100%, right? Because you can't have people everywhere in every home checking 100% of the time. But we will get feedback from residents themselves. We will be doing random checks. And if, as I said, there are any breaches, enforcement actions will be taken.
Let me deal with 2 pilot projects in Tanjong Pagar and Ang Mo Kio. These 2 are pilots, and therefore we will begin carefully, cautiously. In the initial batch, we'll probably invite between 5,000 to 10,000 seniors in each of these 2 areas. And eventually, you can take it that we will have to invite everybody, whether seniors or young people. All the residents in Ang Mo Kio and Tanjong Pagar will be involved in this vaccination exercise. But for the pilot itself, we will start with between 5,000 to 10,000, and depending on the response, we may increase the number or we can reduce the number. It will be done progressively. And after the pilot, soon after the pilot, from the middle of February, which is in 2 weeks after the pilot has started, we will begin to roll out to the other areas, other precincts progressively. And we will also set up vaccination centers in these precincts progressively. And as and when the centers are ready, we will then send out letters to invite the seniors to come forward for vaccination. And we also will be setting up grassroots outreach programs to reach out to them, to encourage them to make a booking for the vaccination. So after the pilot has started, within 2 to 3 weeks' time, we'll begin to roll out additional vaccination centers, and we'll start to vaccinate progressively the other parts of the island.
Thank you, Ministers. Can we now have the next question from Hui Min from CNY Digital, please?
Yep, hi, thanks for taking my question. So my question is not really related to this part here, but kind of about the testing of truck drivers, which started today, right? So, today was the first day and there was reports of delays at the checkpoints, even though not everyone was being tested because we're only testing those that come in from Malaysia. So how feasible is it for everyone to be tested every time they drive into Singapore? Because, the delays seem quite severe. Thank you.
Maybe DMS can give an update on today's operation.
Thank you very much for the question. In fact, ICA, as well as the various sector leads have been working very closely to make sure that they carry out testing operations at the causeways with the minimum of disruption, and they do understand the impact that testing can have on the smooth running of operations, immigration operations and custom operations at the checkpoint itself. So far, through today, the observations have been that the operations have been conducted relatively smoothly. More than 500 truck drivers have been tested, and we're pleased to inform that so far the tests for these drivers has been negative. We will continue to be working through our processes to make sure that we improve on them, so as to make sure that this is not disruptive to both the businesses and drivers, and that the operations can continue without too much delays at the checkpoints. So this will continue over the next few days, and we'll continue to tweak and refine those processes.
Can I just make a quick point on this, and the broader point about our border measures? We are taking no chances at our borders, and we are continuing to keep them tight in terms of the measures, that control measures we have in place across all our checkpoints. I think in recent days or over the recent weeks, you will see sometimes imported cases being quite high. That's a reflection not so much of the fact that there are more travelers coming into Singapore, because the number of travelers coming in, day to day doesn't really change very much, but it's a reflection of the increase in the infection rate around us. Because of the higher prevalence, we are seeing a higher incidence of cases amongst the number of the travelers who come through our borders. We have put in place a pre-departure test to screen out some of them, but that's still not effective enough because the virus may be incubating. They may test negative overseas, but when they come through, they turn positive. And that's why we have a whole range of very tight control measures, including on-arrival testing at the airports, at all our checkpoints, and now we are extending that to truck drivers across our land checkpoints as well. And then for those travelers who are coming in, we continue to keep the measures tight by having the stay-home notice requirement and making sure that they are in quarantine and then testing them at the tail end of the quarantine. So those border measures remain tight, remain secure, and we will continue to make sure that the borders and the measures at the borders are tight. Even as we do that, I think we have to recognize that the virus is circulating within our own community silently. And that's why we cannot let our guard down, and we must continue to stay vigilant, and that's why we have this latest series of tightening in our own community measures in order to help minimize the risk of transmission.
Thank you, Minister and DMS. Can we have the next question from Stefania of the Financial Times?
Hi, good afternoon. I was wondering about the Pfizer delay that you mentioned. Could you tell us how much the Pfizer delivery will be delayed by, and how many doses we are talking about? And I understand that you're saying that ultimately it won't necessarily dent the overall objective of vaccinating everyone by sort of fourth quarter of this year, but specifically for this delayed batch, how much of a delay or a knock-on effect will it have in terms of the administering of the vaccine in the shorter to medium term for you?
As I explained earlier, I will not be able to give you specific numbers, but I can share with you that this particular shipment that has been delayed is scheduled to arrive in time for our vaccination program rollout plan. But the important point to remember is that this is the first time that we are seeing delays as a result of the manufacturing plant being renovated, upgraded. There will be other reasons for delay in time to come. It could be higher demand from other countries which have huge outbreaks which may need them more urgently. So the manufacturers may divert some of the supplies to other areas, or the production may have interruptions from time to time. shipment may also, logistics arrangement may also be interrupted, may be disrupted from time to time. So there are a lot of uncertainties. So we have, as I explained, we have made purchases, advanced purchases from diverse sources of supplies, different vaccine suppliers, and supplies are scheduled to come into Singapore over a period of time. And our vaccination programs is planned based on the arrival schedules. And of course, we have some buffer so as to ensure that our vaccination program can progress as smoothly as possible, but we must expect disruptions from time to time. And therefore, I would urge Singaporeans, when your turn comes for the vaccination, please do make an appointment early because there will always be a possibility of a disruption as we go along, as we move forward.
Thank you, Minister. Can we have the next question from Elaine of Central News Agency, please?
Hi, Minister. I would like to ask about the updates of the review of 2 other vaccines that Singapore has made purchase on. Can we expect when the result will come out? And also, can you let us know that when can we expect the vaccine program be extended to other long-term residents here in Singapore? Thank you.
Thank you very much for the question. The Health Sciences Authority presently is engaged in the review of the other vaccines. They had approved the Pfizer-BioNTech vaccine under the Pandemic Special Access Route previously, and the other vaccines that have been reviewed are also being processed along the same framework. We anticipate that we would have a decision made soon in our evaluation for one of the vaccines. The other vaccine, I understand we are still clarifying further details with the company that produces the vaccine, and we are hopeful that if we are able to get all the information necessary for evaluation, then HSA can complete its review process and then give approval for the other vaccines as well. So we are very close to coming to a decision for the next vaccine, and we will make the relevant announcements as HSA makes that approval known to us.
With regard to your question on when are we going to start vaccinating the rest who are non-seniors, other residents in Singapore, I should add that even as we roll out the vaccination for seniors, we have actually started vaccinating the younger population, especially those who are on the front line. Healthcare workers, for example, we have already started quite long. That was the first batch, in fact, and then followed on by frontline workers who are non-healthcare workers. And we are also progressing to vaccinate those who are in the essential services, that we need to ensure that they maintain our basic services. And we have also started vaccinating some of our SAF personnel, as you have read in the papers today. And therefore, it's a progressive program that we will continue to roll out our vaccination program for the general public, as well as essential workers and essential personnel, including our frontline workers. So they are running in parallel. And as time goes on, we will expand both our vaccination for the senior as well as the younger population.
Thank you, Minister and DMS. Can we now have the next question from polling of Channel 8, please?
Hi, Ministers. I would like to clarify on the point that you guys made on 8 distinct visitors per household per day. Do you mean that does this mean that at any one day, in a day, a household can welcome 8 different visitors? Because we know that during Chinese New Year, people usually stay for very long hours. So does it mean that I can visit in the morning, then I come back at night, but it's the same people? I don't know how it works. And also whether the visitors can overlap in terms of timing. Like, I have 2 families coming at 2 p.m. at the same time. Is this allowed?
I think the rules are very clear. It's just 8 persons, distinct persons per day. Right? We never set any stipulations on timing or length of visits, but it's 8 distinct individuals within the day to a particular household. So, I mean, it goes back to, I think, but the mindset goes back to what we've always been emphasizing. For every rule that we set, please do not try and optimize your maximum gain around the rule as though this is something that you could, gain some additional benefit out of it. Because in the end, the more you try to optimize by having more exposure, more interactions, in the end, you are putting yourself and your loved ones at risk. So we again appeal to everyone, understand the principle and the underlying reasons and rationale for these rules. It is to reduce interactions. So for an elderly who's at home, you don't really want that person to be exposed to multiple individuals. Or if you say the person comes morning, goes out, and comes back again in the evening, it's just more exposure to the elderly person. So the underlying principle must be, let's reduce exposure to one another, because the more exposure we have, the more interactions we have, the higher the chances of transmitting the virus to one another, even in without knowing it, because the virus can spread in ways that may not be obvious to many of us. There could be hidden transmission, asymptomatic transmissions. So understand the reasons why we are putting this in place, and we seek everyone's cooperation to minimize their visits, and if they do need to visit, to keep their exposure as short as possible.
Thank you, Minister. Can we now have the next question from Chin Sen of Today?
Hi, Ministers. Junsen from Today here. My question is, what are you hoping to glean out from these pilot vaccination programs, and what are the things that are still quite unknown about vaccinating a population that you hope to actually learn? And whether this vaccination program is a two-dose kind of a vaccination program, you're hoping to roll it out to the 10,000 people, 2 doses rather than just 1 dose. And a second related note is, I noted in the press release that it said 39 NCID staff have completed 2 doses. My understanding is that there were 40 who went through the first round of vaccination. So what happened?
Maybe I ask DMS to respond to the issue on the vaccinated numbers.
Well, I'm going to answer both your questions. I'll start first with the pilots. The purpose of the pilots is to make sure that the processes we put in place are robust enough that when we now start dealing with a larger group of people coming to the vaccination center to be vaccinated, that this will be a smooth, efficient process, but also at the same time a safe process for all that come forward for vaccination. Each site where we set up a vaccination facility has its own unique challenges because the location is a bit different. We started out with vaccination facilities in our hospitals, and in the hospitals there were ready facilities that we could use to provide safe care. And there was a lot of staff that were present. We also performed vaccinations at our polyclinics that required a different set of design of the facilities, given that the space constraints within the polyclinic were very different compared to in the hospitals. And as we set up the vaccination centers, this required us to design the placement and location of the stations to maximize the use of space, to accommodate a larger group of people coming in, but at the same time to make sure that the vaccinations were safe. Now we're talking about pilots where we want to bring seniors coming into the vaccination centers, and seniors will have their own challenges. Some may have mobility issues, others may have other concurrent medical conditions that require a lot more attention to be paid to ensure that we can observe them safely and have them looked after properly within the vaccination centers. And that requires us then to work out those processes through these 2 pilots. Once we are confident that the processes are tweaked and are optimized, and we are confident that we can look after our seniors properly, we are then going to roll this out, opening up new centers, scaling up the capacity for vaccinations with each center, and then increase the throughput for vaccination for seniors in all the centers that we set up. So that explains why we still need to carry out several other pilots as we open up for a new group of our population that is to be vaccinated. You're right that we started out with about 40 healthcare workers being vaccinated. We have recommended that they should have their vaccination, the second dose of vaccinations 21 days later, but it's not always possible for individuals to come in and have that done exactly and on that same day. For a variety of different reasons. Some people may be working at that point in time, and therefore when we actually had the original cohort of staff that came from NCID having their vaccinations, it turned out that we had 39 being vaccinated on that first day, but I'm quite optimistic that the remaining healthcare worker will eventually also get vaccinated. It's just a matter of scheduling. And the difference in dates does not lead to any significant impact in the benefit of vaccination for the healthcare staff. It's a scheduling issue, and it's also when they are available to come forward to get that second dose done.
Thank you. I should just add that one of the purpose of the pilot is also to ensure that, because the target group for the first batch are the seniors, and we will also need to test our messaging, our explanation, our outreach to make sure that we are able to reach out to them. As I mentioned, I think during the previous press conference, that seniors is a very challenging group for us because many of them are staying at home. They don't come out because of the COVID-19 situation. So it's not so easy to reach out to them. And this is one of the areas that we want to also pilot in conjunction with the People's Association, how we can effectively reach out to this group of seniors to explain to them the process and to help them go through the process. The lessons that we learn from this pilot will then be implemented in subsequent vaccination efforts that we roll out. So this way, for the subsequent batches of seniors, it will be a much easier and more simpler process for them that has been tested, and this will give us more confidence in rolling out the programs in a larger scale for the seniors in time to come.
Thank you, Minister and DMS. May we now have the next question from Shahida of Berita Harian, please?
Hello, hi. Good evening, panelists. Shahida here from BH. Minister Wong, just now you mentioned that you will not hesitate to take additional measures. So, question is, what is the threshold in terms of local community infection? Will the task force, take a look before the task force consider adding additional restrictions ahead of CNY? Also, in terms of surveillance testings given to stallholders and delivery riders, does that mean that these group of people will also be given priority for vaccination? Thank you.
Thank you. I thank you for the question. I almost feel a sense of deja vu because we had to entertain a lot of these questions last year when we were talking about potentially looking at different sets of measures and the indicators that might lead to further step up of measures. And we are back in the same conversation again at the start of this new year. And the answer, as we have given before in the last year, applies this year too. We do not look at any single measure. We have to look at a range of indicators. Obviously, we will look at the number of cases each day, especially the unlinked ones, right? The cases that come up and emerge, for example, if there are already cases that are under quarantine because of our contact tracing, in that sense, it's quite different from some new case that emerges completely unlinked, which might suggest a new unlinked cluster. So we will look at that as one indicator. We continue to test everyone that reports to the doctors, GPs, and polyclinics with acute respiratory infections. We test them. And we also use that as a surveillance indicator. If that indicator goes up over time, again, it's cause for concern. We look at the prevailing safe management measures and compliance with the safe management measures, that if people are keeping to the measures, then it gives us some confidence that there is discipline, there's control, and people are complying. But if there is a lot of non-compliance, then there is, again, a cause for concern. So we look at these range of different measures, and based on the overall assessment, we based on the latest situation and assessments, we will then consider whether or not additional restrictions or measures might be necessary. So that's the way we would deal with, that's the way we have dealt with the infection all this while from the outset, and we will continue to do so. In terms of prioritization for vaccinations, we have prioritized healthcare and frontline workers, but particularly the ones who are at the border checkpoints, because they are the ones who are potentially more at risk, right? And that would include workers in our airport, workers in the maritime sector. It would also include workers in the wholesale markets, for example, that interface with some of the delivery riders coming from Malaysia. So our the key priority, right, is to make sure that these workers who are in our new front line, they are the ones who are doing essential work to keep things going, to keep life going in Singapore, but they are exposed to travelers, they are exposed to crew from overseas, truck drivers from overseas, and therefore they are at risk of bringing the virus into the community, and that's why we are putting them as priority.
Thank you, Minister. May we now have the next question from Evgeny of Itatas, please?
Good evening, thank you. Now, numbers of countries are considering to introduce so-called vaccine passports. What is your position on this issue? And do you have a plan to require foreign travelers to be vaccinated before entering to Singapore? Thank you.
Well, I think the key question for us is not so much to have a vaccination passport per se, but we have to think very hard about what sort of benefits would we confer a vaccinated individual, particularly with regard to travel. And this would apply to travelers from overseas coming into Singapore, as well as Singaporeans who want to travel outbound and then come back home after that. And as we have said before, we are studying this particular issue very carefully. If indeed the vaccination confers not only protection for the individual, but confers sterilizing immunity in the sense that it also helps to reduce transmission risk of the virus to another individual, then there is a chance that we will consider reducing the quarantine or stay-home notice requirement for vaccinated individuals. And that would apply to any vaccinated individual from overseas or a Singaporean who is vaccinated wants to travel out and then come back thereafter. So it's still something that we are studying. There are some early results from other countries suggesting that there is a good chance that the vaccine can produce antibodies in the vaccinated individual, and it can reduce transmission risk. I think Israel did a study of the vaccinated individuals, and they found a very high level of antibodies generated, which suggests that there is a significant reduction in transmission risk when you are vaccinated. But these are still early days. We are still studying the data and the evidence very carefully before we make any decisions on this matter.
Thank you, Minister. We will now take the last three questions. Next, can we have Nigel from Mothership, please?
Hi, Ministers and DMS. I have two questions relating to home visits. For the first one, can I follow up on what Minister Lawrence Wong said about random spot checks by enforcement officers? I believe this is something that we have not experienced before in the previous phases. So just want to find out about the random spot checks. The second question, right, is about the individuals being limited to visiting 2 other households per day. So just want to check whether this is a strict limit or whether the 2 household limit is an advisory which is going to be left to individuals' discretion.
Thank you. Random spot checks have been done before. It's not new. So we did it in the past as well when we had rules and limits on house visits. And so we will continue to do so. But as I said, this is not something that is going to be so easy to do. We acknowledge it. And that's why, again, we call on everyone to cooperate and to do their part. And obviously, some of the checks will be done, will be sort of precipitated by feedback that agencies receive from time to time, right? Again, this is not new. We had that experience during the circuit breaker, during phase 1, and so we are adopting a similar posture. It's not a new thing. On the advisory, or on outgoing, I talked about the incoming rule, where the household can only receive up to 8 distinct visitors per household per day. That's a new requirement. We are putting that in place in regulations, will be enforced. On outgoing visits, it's much, much harder to enforce outgoing, right? And therefore, it will be an advisory, and we are strongly advising everyone, if you are going out to visit, keep it to not more than 2 other households per day, and particularly during the Chinese New Year period, limit the visits to your family members only. It's, you know, we have had instances where we have strongly advised Singaporeans to do what's sensible. Remember during the circuit breaker, where we talked about going out by yourself, alone. Don't go out in more than one person. Just if you have to go out to exercise, for grocery shopping, go out alone. That was not a regulation, it was an advisory, but many Singaporeans, many people in Singapore understood the importance, the necessity for such a measure, and complied with the advisory and did their part. They cooperated. So again, for this new advisory, we call on everyone to cooperate and to do their part to help us keep the infection under control, so that together we can avoid having to impose further drastic measures down the road.
Thank you, Minister. Can we have the next question from Cheryl of CNA, please?
Good evening, Ministers and DMS. I would like to check why we are starting the 8-person rule relatively early on the 26th of January, given that Chinese New Year is in the 11th of February. And also for the seniors, is there any reason why we are not perhaps starting with nursing homes? And also, given that we are starting with seniors, could you also paint us a picture as to how the booking process will look like? Are we using SingPass, for instance? Thank you.
So the new rule for home visits really arises from not just the concern about upcoming Chinese New Year, but it also arises from concern of what we have seen and the experience that we have seen so far up to now. As I said, the recent increase in cases in the community didn't just happen out of nowhere. They are the result of increased interactions taking place over the New Year period. And there should be no doubt, I mean, all of us looking around, watching, observing our interactions, it's quite obvious. Interactions have gone up. We knew this would happen because this is part of phase 3, right? And it is deliberate. It was meant to happen. But with interactions comes greater risk, and therefore we have to watch the situation very carefully. And that's why, based on the recent cases that we have seen, based on the concern highlighted earlier that we are seeing increased signs of complacency in the community about the transmission risk, we think it is timely to make a preemptive move now and not wait till Chinese New Year. But we don't want to take any chances. We do a preemptive move now. We tighten our measures, and again, we call on everyone to cooperate with them.
For the nursing home, I think you asked about whether we are vaccinating the nursing home residents. In fact, we have started vaccinating nursing home residents. I think earlier on when Minister Wong and I visited Kwong Wai Siu Hospital to get vaccinated and to look at the vaccination of the healthcare workers, I mentioned that nursing home residents will be vaccinated right after the nursing home staff have been vaccinated. So earlier this week, we have started vaccinating the nursing home residents, and this program will continue as we move forward. I can ask DMS to talk about the registration approach for the seniors when they need to make a booking.
Yes, with regard to registration, we're working through those processes with the People's Association, as well as the grassroots organizations. They have a better understanding of the different ways in which we can reach out to our seniors, bearing in mind that not all seniors are ambulant and not all seniors are actually moving out of their homes at this point in time. So we would move out and use a variety of different ways to allow them to be registered. Not all seniors are IT savvy, and therefore it would not be necessarily the best way to only depend on SingPass or similar technologies for registering them. We hope to use a variety of different approaches in order to provide better access for all these seniors to the registration and booking for vaccination slots. So this is something that we are fine-tuning at this point in time, and we hope to be ready to announce how this will be done as we launch the pilots in Ang Mo Kio as well as in Tanjong Pagar.
Just to add, essentially we will send a letter to all the seniors that will be invited to make a booking for their vaccination, and the detailed instructions will be in the letter that we will send to them. It will be quite similar to what they do today for booking an appointment at the polyclinics or to see a doctor at the hospital. It's similar, but again, because these are seniors, some of them may not be so savvy with technology or internet. So therefore, we are going to tap on the People Association's volunteers and grassroots organizations to reach out to them to help them. And for those who have a problem or have questions or need help, they can also go down to the CC nearest to them, and the CC, the community club staff have been trained how to help them make a booking for the vaccination. I think this way we try to speed up the process, keep the process simple, and yet because we need to scale them, we will need to find ways to make it as seamless as possible.
Thank you, Minister and DMS. We will take the final question from Eugene, Simin Daily News, please.
Thank you, Minister and DMS. This is Ijing here from Shimin. As in the press release, it said that as of today, more than 60,000 individuals have received their first dose of the vaccine. So just wanted to find out from the ministry whether you have received any reports of the recipients develop any mild to serious side effects, and then do you have any breakdowns of what are the common side effects that have been seen in Singapore? Thank you.
Thank you very much for the question. We have a process for tracking adverse effects, adverse events as they arise. And this goes through the institutions which perform the vaccinations, as well as other doctors who may see patients who have had vaccination and have had any adverse effects. These are sent to the Health Sciences Authority, who has a pharmacovigilance program to receive these reports and then to process them. Any adverse event reports are reviewed by expert panels within HSA to determine the severity of these adverse events, and there's also reports that then would be sent to the Ministry of Health, where we will also consult our experts to determine whether or not we need to adjust our list of indications or precautions that need to be taken for vaccination. So that's in general the process which we have put in place for tracking adverse events. There have been some reports that have come in, but we are in the process of collating and compiling these reports, submitting them to the expert panel for review and recommendations. And as soon as we are able to get those recommendations out and we have organized and categorized these adverse events, we will be then able to publicize and inform you what those adverse events are. In general, the majority adverse events in the various countries that have launched vaccination programs, most of these adverse events are very mild. They generally are local reactions that take place. That includes pain, redness, swelling, soreness of the muscles where an injection had taken place, There are some who have reported previously fatigue, more generalized muscle aches and fever. Many of these symptoms, in fact, reflect the body's immune system responding to the vaccine dose that has been injected in them. And there will be some that may have more serious side effects, which include allergic reactions of a variety of different grades of severity. But as I mentioned, we are still categorizing and compiling the data. And once we have that properly organized, we will provide an update.